how to find the right therapist. Hi, my name is Luke Vu, clinical psychologist, mental health expert, helping young men overcome digital addiction, depression, and anxiety. Today, we're talking about when you might need therapy and what to look out for when you're ready to start. Quick disclaimer, I'm not your psych, this isn't treatment, and if you need a psychologist, you should find a registered, qualified psychologist in your area. So, when do you need therapy? You don't have to wait for your symptoms to be really severe before deciding to seek professional support. In fact, the earlier the intervention, the better. So if you're experiencing depressive, anxiety, or addiction symptoms that interfere with your quality of life, your ability to work, and your ability to love, then that's when you should think about getting professional help. However, before you rush out, it's best to do a quick basics check. Are you maintaining a good diet? Are you maintaining healthy sleeping patterns? Are you engaging in your hobbies and having fun regularly? Are you regularly connecting with your friends and family? If the answer is no, improve these things as well. Just sometimes getting the basics right can make a noticeable difference to the severity of your symptoms. Now, if it's been more than 2 weeks and your symptoms don't seem to alleviate or pass, then it's worth getting a professional opinion. Now, a quick caveat, if you're having mental health symptoms and you can't seem to identify a clear trigger or precipitating event, then it's worth mentioning this to your GP as well. If they're concerned, they will do a mental health and physical assessment and quickly explore some contributing factors you might not have thought of. So what are the common barriers to taking the first step to seek help? And there are so many. Sometimes the idea of sharing your thoughts, beliefs, and symptoms to someone else is really scary, especially if it's to a stranger. But I find that once you start, it can be liberating when you don't need to self-monitor and just share what you're going through. Sometimes people may overthink what therapy is and how it reflects on them as a person. But essentially, you'll be engaging the services of a highly trained health professional that will listen to you and recommend an intervention that will likely improve your symptom. It's up to you to take that on board and go for it. So what are the common stigmas surrounding therapy? Number 1, going to therapy means I'm weak. Absolutely not true. You don't go to therapy because you're weak. You go because you acknowledge there's an efficient way to work on a problem that you're having. If you break your arm, yes, you can try to fix it yourself, or you can see a doctor to make sure it heals properly. It's the same thing, but for your mental health. Sometimes the problem is just too close for you to deal with by yourself, like cutting your own hair. Perhaps it's just more convenient if someone else helps you with it. Number 2, therapists would judge me and talk about me to other people. No, your therapist is likely to be the least judgmental person because they are trained to be. And also they aren't in your circle. They're bound by law not to disclose any patient information. Number 3, I'll forever be dependent on a therapist. Not true. Technically, you can leave your therapist's room and never come back. No one is stopping you. What's more likely to happen is that as your condition improves, you'll see your therapist less and less, and in due course, complete treatment. And as you kick ass in life and encounter more complex challenges, it's possible that you relapse to old habits, which happens to everyone and is completely normal. At that point, you can decide if you want to come back or get in touch with another therapist. By the way, I'll let you in on a secret. Your therapist is cheering you on and celebrating when you've completed treatment and are symptom-free. That's why we chose this role. If you come back for a booster session or there's a different issue, we'll always be there to help you figure it out and work through it. Sometimes it just needs new tools, new techniques, or just sharpening up your old ones. Let's say at this point of the video, you're curious and you want to know how to find one. Well, there are many therapists out there. So what kind of therapist is most suitable for me? You think that it's something completely clear-cut and you'll know exactly how this therapist works before you start. Sadly, no. It's totally unclear to the everyday person, even unclear to me as a psychologist sometimes. So let's break that question down. Firstly, the word therapist is really general. A counselor, a psychologist, a psychiatrist, they're all therapists.
Choose your fighter.
If you have a mental health disorder confirmed by a mental health professional or medical practitioner, then I recommend you seeing a mental health professional. And this means a psychologist, a psychiatrist, a counselor with specific mental health training, a social worker with specific mental health training, or a nurse with specific mental health training. In a nutshell, psychologists spend years of training almost exclusively in psychology, whereas other professions have a larger part of their training in other areas. So what kind of psychologists are out there? To answer that question, I think it's best seen as a broad variety of styles a psychologist could have. There are those who prefer the pragmatic style, which uses cognitive and behavioral tools, and typically there are clear phases of goal setting and assessment, review and intervention. Those who prefer the explorative style allow the patient to explore and direct where the conversation is going. Those with approach-driven styles are committed to a specific treatment approach and follow it as much as possible. This could be EMDR, which uses eye movement techniques to help patients heal from trauma. It could include mindfulness, which teaches patients to consciously pay attention to their thoughts and feelings without placing judgments on them. Or ACT approaches that teach patients to live and behave in ways consistent with their personal values, while emphasizing psychological flexibility. Some psychologists prefer niche-specific styles, meaning they prefer to work in a given area, such as addictions or eating disorders, adolescent mental health, or even digital addictions. There are those who prefer attachment or childhood-centric styles, and they're really big into understanding how your way of thinking was formed since a very young age. And lastly, those who prefer the eclectic style, which don't fall into any type of category. They just mix and match approaches as they see fit. What's important to know is that there really isn't a best style. It's important that you find a therapist that's the best fit for you. In fact, the quality of the therapeutic alliance is the biggest factor in terms of getting positive outcomes. Now, how do you actually start therapy? For the last part of this video, I'm going to explain how to book an appointment, what to look out for, and how to know if you found the right one, which is super important for you to finally alleviate your symptoms and have a better life. Let's start with the first one. To book one, you need to find one first. Research your issues and therapists that can help you with that in your area. For starters, you can always ask your treating GP and friends for recommendations. Look into their treatment approaches by checking out their work on their website or maybe their YouTube channel or blog. Once you determine that you have the resources and energy to commit to treatment, say 10 appointments across the next 12 months, then see if you can call to schedule a quick conversation with the treating clinician. If you can, this is where you can get a quick vibe check before you schedule that first appointment. Otherwise, trust that your research has led you somewhere and make that leap of faith and go to the first one. Dive in, book that appointment. In your first session, expect it to be a mixture of admin and initial assessment. That is, the psychologist will explain the nature of therapy, confidentiality, its limits, assess risks, and help you understand the treatment rationale and any issues that might arise. Now, it's hard for clinicians to guess how many sessions are required, but there has to be some reasonable expectation of response to treatment. Diagnosis or psychometric testing through questionnaires are often done here to get a good baseline of your symptoms. So before you go into your session, have a think about what you want treated and why you think it has happened. Have reasonable expectations to get better, but also know that progress is non-linear. In this session, expect to talk a lot about yourself. Expect to hear recommendations to attempt, and expect your psychologist is going to work towards fixing the problem as hard as you are. Now, let's say you've gone to 1 or 2 sessions and you still want to check if you found the right one. Ask yourself, did you get a sense that this therapist understood the problem you described? Did you have an understanding of the therapist's treatment approach? Did the therapist listen to your concerns? Did the therapist validate your emotions and beliefs? Did you feel that the therapist was non-judgmental? And did you get a reasonable sense of confidence that this therapist can help you? If the answers are all mostly yes, then you should feel relieved to know that they're worth going to. And if not, that's okay too. Going through the process of searching for the right one for you will be worth it. Your future happier self deserves it. I hope this helped you understand how to look for a therapist, what to expect, and what to think about when you're looking for the right one for you. And if you found this useful, don't forget to hit subscribe. I'm Luke Vu. Be kind, be you. Catch you next time.